opiate addiction is really different than addiction to other substances. It has a different effect on your brain chemistry. Abstinence-based treatment programs don't address that very effectively, so you end up only getting half the treatment that you need. The treatments that you've been receiving in the past, often for opiate addiction, are not the right ones. But then you, as the person who hasn't done well in that treatment, get blamed for not doing well in it, when in fact it's not the right thing. This is the right place for you. So what we do is we give people what we're calling replacement therapies, methadone and now buprenorphine, that goes to these same receptor sites in your brain and stimulates them. But the difference between that and the drugs that you're using on the street are several. One is the drugs that we give you in replacement therapy, if they have any buzz, it's very small, and it usually only lasts for a little while. It goes away. People become tolerant to that. They're long-acting, so they stay in your blood at a steady level all across the day. Right? When you're booting heroin, it's like up and down and up and down, right? They're short-acting and it's awful. And you have to keep using periodically across the day in order not to be sick. Buprenorphine and methadone, nice and level all the time. That tends not to hurt your brain chemistry in the same way. It's that rapid up and down stuff that tends to do that to you. So what it does is it's sort of like being diabetic and taking insulin that regulates your blood sugar. You're taking a drug that regulates a natural neurochemical system that you need to have on board every day in order to feel great, in order to feel well. The one thing I will tell you, though, is that this is not a magic bullet, and those of you who've been on it a while know this. You can't make little tiny tweaks in it, right? If you have a bad day, and the amount you have on board is not enough to sort of compensate for that and make you feel better, I can't give you a little bit more methadone at that moment, and like you could with insulin if your blood sugar was wrong, so that you feel better that day, because it takes 2 or 3 days for you to get an effect from the methadone. And so what would happen over time is you'd get on huge amounts of the medication with us trying to always make you feel better that day. So part of your job in a treatment program like this is to do the work that you need to do to learn how to take care of yourself in a way that will help you deal with that part of the days that aren't good. But it's possible to do, and it works really well. You can learn techniques that will help you do that. There's no way for me to know exactly how much opiate receptor site damage has gotten done by the drug usage that you've done, but I can give you 5 things that you can think about, give you some idea about how compromised your brain chemistry might be. First thing that matters is how long you've used. The longer you used, the more damage gets done to your opioid receptor system. The longer you use. A year is plenty of time to cause significant damage. 5 years is a lifetime of using. That's a long time. It does a lot of damage. Second thing that you can look at is how much you used. There are some people who use like large quantities of opiates all the time, never take a break, just keep using more and more and more, right? And then there's other people who kind of chip around a little bit, don't use quite so much. Maybe they take vacations once in a while from using, that sort of thing. If you're somebody who used large amounts all the time, that does a lot more damage than if you're somebody who was able to take breaks once in a while or reduce their usage amount once in a while. That's another reason we do the harm reduction thing. If we can work with you on taking a month, a year off from using, we can significantly reduce the amount of damage that gets done to this neurochemical system for you. So that's part of why we do things the way that we do it. Third thing that you look at is the way that you used. If you take an opiate medication like OxyContin as a pill the way it's prescribed, these same things still happen to your neurochemistry. You still get dependent on the drug, you still have problems with it, but way less than you do than if you crush it up and snort it, and then that's way less than if you're an injection drug user. And that has to do with how fast it gets into your system and how much of it gets to your brain. The fourth one is one that often will surprise people. It depends on what your drug of choice was. If you were somebody whose primary opiate usage was OxyContin as opposed to heroin, that does more neurochemical damage to you than the street heroin does. And the reason for that is because pharmaceuticals are designed by the drug company to go to those parts of your brain very quickly and be very effective at stimulating those parts of your brain. And so more so than something like heroin, which is much more crudely produced, or morphine. The fifth thing that matters is something that you can't do anything about, and that's your genetics. That's what you're born with. How likely was your brain to have this problem happen to it? I've been doing this work for about 12 years. I've known people who seem pretty bulletproof to opiates. Like they would use them off and on and nothing really ever seemed much to happen to them. I mean, they get high, but they wouldn't really get that addicted.
That happened to me for a while.
Right, and then other people who, from the first time they ever used it, they felt their brain chemistry really changed. They knew they had done something that was never going to be undone. You've all made significant neurochemical changes in your brain chemistry. Yes, it can get better, but I can't tell you exactly how long it's going to take you. One thing I do know is that we've been doing methadone treatment for about 50 years, so we have a lot of information about how this works, right? And what we know is that anybody who comes into methadone treatment needs to stay in this treatment a minimum of 2 years. 2 years. People should have told you this if you're on methadone before you do this.
Yeah, what about...
Well, we don't have nearly as much information. We've only been doing Suboxone the last couple of years. The best guesses that the people who are doing this are making is that you're looking at kind of the same thing. That it's going to take significant lengths of time, several years of treatment, of maintenance treatment. Methadone treatment, the most common way to treat opiate addiction in the world. There are 200,000 people every day in America who get methadone treatment, and now there's about 5,000 Suboxone patients, and that goes up significantly every day. And we think over the next few years there'll be 20, 30, 40,000 people in Suboxone treatment as we go forward. If you stay in methadone treatment for 2 years and you do a good job of taking care of yourself, eating well, sleeping well, getting back into the work life, go back to school, whatever it is you have as your own personal goals, and you do a good medical taper off that with the doc helping you supervise that, 60% of you will stay opiate-free from that point forward. For many people, what they find is over time they're able to go off methadone and do pretty well after that. But about 10% of you are probably going to end up on methadone for the rest of your lives.
Yeah.
It may be a small amount, it may be a large amount, it's whatever amount you need. But it's not about your behavior, it's not about your motivation, it's about your brain chemistry. It's really about how much better your brain gets in that period of time. Does that make sense to you, what I'm saying about how this works?
Definitely.
And that's why we use replacement therapies in treatment of opiate addiction and why it works really well. No more craving for people. Usually we're able to get people to not use opiates anymore. 90% of the people who come into this program stop using opiates within 2 or 3 months after they get here. And we're really able to help you get away from that lifestyle of using.